On September 29th, the Centers for Medicare and Medicaid Services sent a letter to the 50 states reinforcing that the states will have to start providing continuous coverage to children in their Medicaid and children's health insurance programs starting in 2024. It means eligible children enrolled in Medicaid and the children's health insurance program have uninterrupted coverage over the course of a year, even if that family's income eligibility may change. CMS says this is part of its ongoing work to make sure all Americans have access to health care coverage. In fact, in a statement, the U.S. Department of Health and Human Services Secretary Becerra said, children should always have access to health care services, no exceptions. And he continues, this important action will ensure children have access to the preventative and primary care they need to be healthy and thrive. We will continue to support children and their families whenever and however it is needed. And CMS Administrator Chiquita Brooks-LaSure adds, CMS continues to work to increase access to health care services for children in ways that reduce disparities and build a reliable health safety net for every young person. And she says this is going to bring families some peace of mind as well. CMS says continuous coverage for kids is achieving several of their goals. It promotes access to appropriate preventative and primary care. It promotes health equity. It prevents interruptions that impede access to health coverage, and it reduces financial barriers to care, especially for those low-income families. It also provides states with better tools to hold health plans accountable, supports better health outcomes, helps healthcare professionals develop those relationships with the families they're serving, and reduces some administrative burden. Now, the authority for this continuous coverage for children comes from the Consolidated Appropriations Act of 2023. The feds also remind states in this letter that they sent that they can do more. They can ask for a Section 1115 demonstration waiver to actually provide longer uninterrupted coverage for children if they want. They could even ask to do the same service for adults. You can read that letter from CMS to states. We link to it in the description below.